In today's video, we're going to review a few important questions you should be able to better answer before receiving imaging for lower back pain. 1. Is imaging really necessary? 2. Are there risks? And 3. What are my other treatment options? Number 1. Is imaging really necessary? Current guidelines recommend against lumbar imaging in the early management of back pain unless the result is likely to change management. Examples of such cases would be when a clinician suspects sinister pathological cause. This suspicion is triggered by the presence of red flags during the clinical exam. Some symptoms accompanying low back pain that may warrant suspicion include unexplained weight loss, a high fever, loss of control of bowel or bladder, loss of feeling or strength in the legs, problems with reflexes, a history of cancer. But how prevalent are serious pathologies? In a study done by Barden et al., it was shown that less than 1% of low back cases actually involve a serious pathology. As we can see, the prevalence of sinister pathology, such as vertebral fractures, malignancy, spinal infection, axial spondyloarthritis, and cauda equina syndrome are actually very low. Even if a clinician decides imaging is not warranted, a patient may still insist on imaging. This is due to the widely held belief that it is required and necessary to confirm the diagnosis and identify structural damage and the cause of lower back pain. But is this true? In a 2014 systematic review, a total of 3,110 people without back pain underwent imaging of their lumbar spine. At 40 years old, disc bulge prevalence was 50% and degeneration was close to 70%. Disc height loss and disc bulge prevalence showed an increase in roughly 1% each year. Disc degeneration was evident in 30% of 20-year-olds and increased up to 96% by the age of 80. In summary, there was an increase in prevalence of abnormal findings with an increase in age. The authors went on to conclude, these imaging findings must be interpreted in the context of the patient's condition. It is not to say that these findings do not matter, but in the context of an individual's pain experience, it should be noted that these are only one piece of the puzzle. Our understanding of pain has grown over recent years, and while there remains a lot of information we still do not know, we are beginning to recognize pain is a multifactorial experience.
Tissue damage and parts of the spine can contribute to pain, but they are only one component. We should also be aware of other influences like genetics, comorbidities, and psychosocial factors as contributors to someone's pain. Again, the findings of an MRI can be correlated to pain, but we cannot necessarily say it is the cause, since pain is multifactorial and we see such a high prevalence in asymptomatic populations.
Next question, are there risks to imaging? In addition to radiation exposure, imaging has shown to have negative effects on health outcomes, medical costs, and work participation. In a study by Graves et al., the effects of imaging had on pain, function, quality of life, and overall improvement were compared between those who received an early MRI to those who received late imaging or none at all. At a one-year follow-up, pain and quality of life measures were shown to be no different between the groups, while functional disability scores and absence from work were shown to be higher in the early MRI group. In addition to affecting patient outcomes, early imaging can lead to higher healthcare costs as well as increased rates for surgery and time away from work. When comparing groups who received an early MRI to groups who did not receive an MRI, overall costs were substantially higher, with differences shown to be over $15,000. Time missed from work was over 100 days, and further medical workup, including injections, surgery, and further imaging, were also found to be higher. And finally, what are my other treatment options outside of imaging? With the onset of acute low back pain, here are a few big takeaways. 1. Stay positive. Most acute low back pain cases will improve markedly in about 6 weeks or less. So do your best to maintain your usual social activities and keep a positive mindset. 2. Avoid bed rest. It may seem like a good idea, but we actually want to keep moving and stay active. This could be hiking, swimming, or a variety of other movements. 3. Self-manage. Oftentimes we will want to find something to help reduce the pain. This can include over-the-counter medications, heat packs, or other simple analgesics. Make sure you talk to your doctor to find out what would be appropriate for you. And finally, 4. Seek guidance. Finding a reliable healthcare practitioner to rule out red flags and help find strategies for managing and treating your back pain is advisable. This information is not to say imaging isn't helpful, as it absolutely has its time and place. We just want to provide everyone with the current guidelines and the evidence surrounding imaging for lower back pain. If you liked the video, make sure you give us a thumbs up below and subscribe to our channel if you haven't already. Thanks for watching.